All right, so this is my phase 2 of 5 for my PCO rehabilitation protocol. Just to recap, we have just completed weeks 1 and 2, and this phase will consist of weeks 2 to 6. The patient had PCL reconstruction surgery on his right leg. So this will be his right limb will be the involved leg for this. And all the exercises seen here are mostly continuations of what we did in phase 1. And these are expected to be done 5 to 7 days a week. So the first exercise we have here is going to be quad sets. So for this exercise, same as last time, the patient will straighten their leg, point their toes up to the sky, like so, and then make a push their knee down and contract their quad. All right, and the patient will do 2 sets of 20 of these to start with, and that can progress to 3 sets of 20, and then eventually up to more reps the farther they go through this progression. All right, so this next exercise is the heel prop, and it will be working on achieving full extension in the limb. So for this, we'll place a assistive device under the patient's foot, in this case a foam roller, because that's all we have at our disposal. And you'll ask the patient to lay here and do nothing and just let gravity force his knee into extension. He will do this for 15 minutes. He will progress up to 18, and then on to 20 minutes the farther we get through this progression. All right, the next exercise we have for our patient is going to be heel slides with the towel. This is going to work on achieving flexion of the knee. Last time we could go to 90 degrees. This time we're trying to get to about 120, 130. The protocol does not specify a max. They just said they want you to continuously be improving flexion of the knee. So for this, the patient will grab the towel here, like so, and use the towel to pull his knee into flexion as far back as he can. They will do a 5-second hold at the top to hold the knee in flexion, and then come back down. That he will do 3 sets of 10 for this, and then that can regress to 3 sets of 12 and 3 sets of 15, again, the farther we go through this whole thing. And then if they begin to feel any discomfort or anything while they're doing this, due to the flexion and it being in, more flexion than they used to, you would discontinue the exercise for the time being. All right, so the next exercise we have is straight leg raises. So for this, the patient will lay on their back. So basically the same motion as a quad set. They will keep their toes pointed all the way up towards them, legs straight, contract their quad, keeping their heels or keeping their hips on the table, and then you will lift this leg to the sky like so, and then come back down. They will be doing 2 sets of 15 for this, and that can be progressed on by adding more sets and more reps as we go through the set. All right. The next exercise we have is hip abduction. So for this, the patient will lay on their side. So you will lay on your non-involved side, facing me. So for this, they will keep their body in a straight line. Shoulders, hips, knees, and feet. Point your toes again like you would do for the normal straight leg raise. And for this, you're just going to lift to the sky like so. Come back down. Again, same for this. They will do 2 sets of 15. Make sure they keep their body in a line and they're not leaning forward or backwards like they have a rod through their hips. And that can then be progressed farther by, again, adding more sets and more reps as needed. And then from there, we can go into prone hip extension. So for this, you will lay on your stomach, scoot backwards so your foot is all the way off the table for me, like so. Again, so point your toes down like this. Again, keeping your hips on the table, glutes, hamstrings, calves, all contracted and tight. You're going to lift this leg up to the sky for me, like so. Again, try to make sure you keep your hips on the table, and they want them to keep all the muscles contracted at the same time. And again, for this, 2 sets of 15, progressed with more sets and reps as they progress through this protocol. All right, our last table exercise we have here is going to be the short arc quads. So for this, the patient will, again, same as all the other exercises, keep their toe pointed, calf tight, and and then contract their quads and bring their legs straight to full extension. So we're doing 3 sets of 10 for this, and then you can progress this by adding more reps as needed throughout the process. The main thing for this is just making sure that they're coming up fully into extension and then relaxing on the way down, but while keeping the leg distal to the knee contracted. All right, and last but not least, exercise-wise, strengthening exercise-wise, we have standing toe raises. So for this, the patient will be, it'll be a double leg position because they're still, at this point, 2 to 6 weeks out of surgery. So it'll be double leg, feet close together, hands on the table supporting them, and they will basically just push up on their toes and lift their heels up off the ground. For this, they would do 3 sets of 10 and then progress as many sets and reps as needed throughout the course of the protocol. This can also be progressed by taking hands off of the table, removing support, continuing to raise up, as long as the hands on the table is pain-free. Then from there, you can go hands on the table, single leg, like so, raise up, and then from there, you can go to hands off the table, single leg. And that will be progressed as long as they are pain-free. All right, so for the final exercise of this stage in my protocol, it will be 15 minutes of stationary biking. So for this, you should make sure the bike is on no resistance, and that they're mostly using their non-injured leg to propel themselves forward. The main goal of this is more range of motion, more so than conditioning. So you just want to make sure you're attaining full extension and full flexion. So if you mind sitting up for a second, I'm going to pull the seat up a little bit. You guys got me right and tighty left and loosey. All right, sit back down. So now he's getting the full extension and not quite so much flexion. So for this, he will pedal again using the non-injured limb to predominantly do the motion. And you will continue to do this for 15 minutes, or if pain becomes evident at any point where it's looking at them, the exercise will be discontinued. Again, no resistance, just leisurely biking, more focused on range of motion, more so than actually any cardiac endurance.